Then when we started doing fifth cervical, we shot through the fifth cervical, which was by far the better idea because we could see more cervicals, because we become no longer were interested. See, when you take just an atlas shot, you get a bunch of hard head and a little bit of neck. Well, really, we're not interested too much in the head. We're interested in the neck. So we drop down and would shoot through fifth cervical. But now, since we're interested in the sella turcica, we shoot through the third cervical. Because the sella turcica is a very, very important thing to us today. So you want to shoot through the third cervical. And when you shoot through the open mouth, you should shoot through the lower third of the mouth, because you want to see the condyles. Now you see the bucky is conformed to his head. You still have that x-ray machine? You sold that fine.
No, I got it. Nobody ever bought it.
Oh, you still have that?
I just put it up in my private shed. Yeah.
I'll tell you what, people, if any of you just want a regular x-ray machine, there's a machine right there that'll last forever. I think I had that. How long did you have it, Kenny? I think I had it 10 years before you bought it.
I got my visualizer in '90. So it's just been sitting around.
And that x-ray machine was brought in 1968.
Yeah, or '69, wasn't it?
68 that one was bought, yeah. 68. I paid $7,200 for that x-ray machine. I think Kenny paid me 10 for it when it was 20 years old, and you know what? It's probably worth 12 now. That x-ray machine will last forever. That's what you call a continental vertiview. That is the x-ray machine that the visualizer was taken off of. But not, this is a visualizer, but the one he has looks just like this. I think it was this one.
Same color.
There it is, right there. That's it. That's the one where we had the two buckies, one on the wall.
Yeah.
Now there's the base posterior. Now we're shooting that at a 50-degree angle. We rotate the entire machine to 50 degrees. And that's what it takes to come up and bisect the angle of the jaw, come up in front of the ear to the crown of the head. Take a base posterior, standing up. Now we're looking for the pelvis. Now on a native P pelvis, you want to make sure you get the ischial tuberosities. And that's what she's looking for back here. Looking for the ischial tuberosity. You want the ischial tuberosity about an inch up on the film. Now keep in mind that if you have a real heavy person that weighs about 400 pounds, that ischial tuberosity is going to be about 4 or 5 inches up below the bottom of the buttocks. Now on most people, you can find it right at the bottom of the buttocks. But if you have someone that weighs 400 pounds or so, remember to bring your machine up past the bottom of the buttocks. Otherwise, you'll have this much dark space on your film, and everyone will look PI. See? So this system was set up to find the ischial tuberosities about an inch up on the film. Now, watch old silly Ed here. See him with that crazy expression? Now watch Kathy straighten him out. Call him sober Ed now. Straighten him up. Now then he decided to pray. Now when you're taking a lateral, you change it. You don't keep the same ray. You take it, see, the other one is shot at the center of the film. This is shot 2 inches above the crest of the ilium. Reason being, we would like to see the 11th and 12th dorsal vertebra. Because the 11th and 12th dorsal vertebra is where you get a lot of stress fractures in older people. And you pick them up on the lumbar view. Now there's the ray we're shooting our rays in. Then we develop our x-rays immediately. Every patient that comes into my office is adjusted the very first day. I do not believe that a person should be put off till tomorrow. Now, of course, practice building courses will tell you what makes a difference. They've been sick 30 years. What makes a difference? Another day. Death. That's all. A person could die before you get a chance to adjust them. Today is the first day of the rest of your life. Do you want the first day of your life to be miserable? No. Then why do you think anybody else would? See? Just treat everybody in your office the way you'd want old mom treated. Now, one guy stood up and said, I hate my mother. Well, no matter what I say, someone's going to come back. He said, I hate my mother. Then what do you do? I said, shoot yourself. So we read our x-rays immediately, and then we're ready to go to work on that patient. So that's basically the beginning to show you why we got started doing the different things that we do. And that's the way that our x-rays, that's the third tray down, Kenny, if you want to put some slides in there. Now look at the last tray, it might have places too. But instrumentation is one of the prime reasons that I found out all the things that I'm about to show you, because I was failing. I wasn't failing financially, but I was failing as a human being. There were nights that I'd go to bed wondering if everybody in the morning found out just how helpless I felt at times. That underneath this crust there was a guy who was very, very unsure of himself. You know how you feel? I felt that way too. Yeah, it was a very, very frustrating situation. I mean, you never could tell anybody, yes, I can help you. You always had to refer to somebody else that you helped with the same condition. And I don't know anyone that's interested in what I did for Bert Jones last year. I think they're more interested in guys sitting in front of them. In front of me, I mean. So today when I look at somebody, I can tell them, yes, I can help you. I guarantee I can help you. Because what we do today works. Now you have two sets of notes there. We have three ways that we analyze the spine. The most basic is line drawings. Line drawings is bodies. You're looking at bodies of vertebra when you draw lines. And these are the rudimentary way. But if you don't know how to draw lines on paper, you'll never learn how to draw lines on visualization. And when I look at a visualization, what I'm doing is in my mind, I'm drawing lines. So when you draw lines, this gives you a basic idea what you want to do. So we're going to draw some lines for you today so that you'll understand the basic rudimentary ways how to look at a spine. So I'll give you another 5-minute break or so here, and then we'll go to work. We've got a ton of stuff to cover, and we're ahead of schedule. And we have a lecture room up there that's round. And each row of seats will be built up 8 inches in relationship to the one in front. Now, the chairs that we have picked out for there is they're on rollers. They have padded arms. They have a padded back that rocks to your back. It also has a thing down here you can pump it up to keep your little tootsies right where you want them. Now, for those people who hate these type of chairs, on each desk there will be a plaque. This area was donated by. All right. Now, Anthony Puglisi bought the first row. They're $150 a piece. And this stuff will all be built in. See? So, if you hate these chairs and you want to continue to come to our lectures, all you got to do is buy your own chair.
There you go.
How many's in a row?
Huh?
How many's in a row?
We will have probably 60 chairs there. At the last seminar, we sold a row plus 4 people bought 2 each, and one guy bought 1. So that's how many we sold so far. But the one guy said, whatever is left, I will take. Steve Salivi. Whatever is left, I will take. And if he don't take them, I'll sell them to Andre Robidoux. But now we're going to sell her one and get her little name on it. This section here is provided by Ursula. Okay, you got our notes there. A cervical line analysis is what we're interested in here. The gravitational weight line. That's a line drawn from the anterior portion of the subluxations to the bottom of the filum, parallel to the side of the filum. So here's your lines here. I want you to draw a line. You see the subluxation up there? That's a little U shape. And that should come down right where the 4th and 5th cervical interspace is. That's where it should set. If you drew a line straight down there, that's where it would set. The atlas angle is 18 to 24 degrees. Now the way you get that is you take a line and draw it through the anterior and posterior tubercle. Cut the atlas right in half. Now the second line should be parallel to the floor, drawn from the posterior tubercle. Draw it from the posterior tubercle parallel to the floor. And that angle would be 18 to 24 degrees above level of the floor. A line drawn at the bottom of the axis should set parallel to the floor, provided the axis doesn't have a big beak out in front of it. A lot of times the axis will have a great big hook on the front of it, which is normal. When it does, then the 3rd cervical will be shaved off. But draw a line across the bottom of the atlas that should sit parallel to the floor. That line is called Whitehorn's line. That's Whitehorn's line or angle, and that should be 0. Right here, the axis. Okay, but you have a line over here, yeah. The 5th cervical is the stressed vertebra. It is the center vertebra of the spine. There is 5 things above it and 5 things below it. The 4th, 3rd, 2, 1, and occiput's above it, and 6, 7, 1st, 2nd, and 3rd is below it. I believe in the growing child specific vertebral subluxations at specific ages. These subluxations are due to the child's stage of development and associated lifestyle. These subluxations, if not corrected, become the chronic subluxations in the adults. Now, why does the atlas subluxate so easy? Well, there's no bony locks on it. When does it subluxate? It subluxates just coming down a bad birth canal. It can subluxate during the birth process, even if it's a normal birth process. It can subluxate especially from a breech birth or from a forceps birth. And it can subluxate from idiots throwing babies up in the air and catching them. And by people carrying them with one hand. People will carry a baby with one hand and let that little head flip-flop all over the place while they're smoking a cigarette and drinking booze with the other hand. Put them on the back of a motorcycle and ride down the road with a helmet on their head. That's what causes atlas subluxations. So the atlas can subluxate between the eight. Now you've got these in your notes. So I'm just reviewing these with you now. When we go through the notes, we'll hit all this stuff again. That the atlas will subluxate. between the ages of birth and 10 months. The sacrum will subluxate between 10 months and 2 years. Now what's a kid doing at that age? They're trying to walk. And they spend 99% of their time falling on butts. Does every one of those falls subluxate the sacrum? Absolutely not. There's a lot of people. They get through 2 years of life without ever having a sacral subluxation. Now what type of fall would hurt a baby? When he tries to go up steps and he falls on a crooked angle. That type of stuff. So we know that the person who made this body would have never given us things to do that we couldn't have got through 99% of the time. You know, everyone doesn't have all of these subluxations when I tell you here, but this is, when people have problems, this is where you look. Third cervical is a very, very important subluxation. It happens from falling on the head. A lot of times you'll get accidents like that between the ages of 3 and 12. What does kids do between the ages of 3 and 12? They make trampolines out of beds. They climb up on stoves looking for cookies. They fall on their head. They stand on their head. They do tumble-saults. They do cartwheels. They climb monkey bars. They fall out of trees. Falling on the head, regardless of what age, is, these are on page 8. Yeah, we're going to rearrange this. We're going to put first dorsal ahead of third cervical. I think first dorsal subluxates anytime after a kid starts walking and falling on his hands. So the first dorsal, as we more and more research into chiropractic, we find that first dorsal is one of the most important subluxations in the world. So we will do this. It's from catching yourself on your hands. And then, of course, the fifth cervical area. The fifth cervical area subluxates anytime after you start participating in sports or any type of whiplash injury. Now, whiplash injury is like skidding on the ice but not falling. See, if you fell on the ice, you'd probably subluxate the sacrum. But if you just fall all over the place but don't really fall, you have more of a chance of whipping your neck. Someone coming up hitting you on the back when you don't know they're there. Hello, how are you? That's a whiplash injury. Playing football where you're running down the field and somebody stops you right now. Those things are all whiplash injuries, and of course motorcycle, automobile, bicycles, all of that stuff is that type of injury. This is used to detect the presence of long-standing chronic subluxation. It is not intended to suggest that dogs will not subluxate as 3-3 if they fall on their head, or subluxate the sacrum if they fall on their buttocks. Rather, this system has been developed as a method to help chiropractors establish the chronic and severity of patient subluxation. This gives a chiropractor a protocol for adjusting. What we're trying to do is set you up a system so you can tell with all of these rules. You know, we're going to give you a ton of rules, and if you study these, you will find out. How do you read x-rays? You should eliminate and try to visually correct any mistakes that were made with the placement of the patient. In other words, if you have a patient who you can visually say this x-ray is wrong, but if I would have done this, then that x-ray would have been right, and what I'm looking at is an illusion, not a true problem. Number 2, examine the x-rays for pathologies. Identify them. You can follow this right through in your notes. I'm sure that they're right in your notes there. And if, you know, I'm not telling you you have to be a pathologist. Shut that door, will you? But what you do have to do is you have to be smart enough to know when there's something there. You know, I think these state boards are so wrong when they make you stand there and analyze an x-ray and give a name to a disease. There is no doctor in the face of the earth that can detect cancer strictly from an x-ray. This leads you to believe, but you should have blood work and all kind of stuff. I would never, ever go on record of telling somebody they had something and then find out what a jerk you are when it really wasn't cancer, maybe it was osteoporosis or something else, you know? And then you're scaring someone to death. Do you realize that if a person is hanging on the cliff and you would tell them something like that, they might go home and take their life or do something crazy? I never tell people stuff like that. You know, I had a patient one time that came from a chiropractor, and he adjusted her for 6 months, and he said, "You're definitely not getting well. So you must either have cancer or multiple sclerosis, because those are the only two things I can't fix." I mean, wait. You know, sometimes people say, "Oh, no one does that." Until you're out there and you see some of the stuff. You know, I defended a guy in court that was using the toughness machine. And the patient said to him, "What is that?" He said, "Oh, my own dad even calls me Dr. Witch Doctor when I use this." Then he laid him down and adjusted his fifth cervical from the back. And the guy said, "What in the world was that?" He said, "I just gave you a reverse whiplash."
Oh, boy.
And he wondered why he was sued. His big mouth can get you in or out of trouble. He was getting in trouble. Examine the x-rays for abnormalities. Congenital abnormalities are birth defects. Acquired abnormalities, fractures, surgical fusions, arthritis, etc. Congenital abnormalities. I have never seen one that caused a problem until a chiropractor starts monkeying with it. You know, one of the worst things to monkey with is spondylos. You know, most spondylos are down at fifth lumbar. Where does the spinal cord end, people? The top of the second lumbar. Spondylos don't cause people troubles. Not till someone, I know 3 chiropractors that had to have spinal surgery. And none of them had any trouble with their spondylo until one of their friends tried to correct it. You know, much to my dismay, one time I had something to do with a book. It was called the PST Manual. It shows how to adjust the fifth lumbar from the front. Don't ever think I had anything to do with that. Because I'd like to see somebody adjust Frank Wilhite's fifth lumbar from the front. Frank Wilhite is my standard. Frank looks like he's about 15 months pregnant. Now, I'd like to see somebody adjust that fifth lumbar from the front without ruptured kidneys and bladder and everything. You can't adjust the fifth lumbar from the front. But yet on state boards, they want you to perform that move. Determine what is normal. Now, see, I think the biggest problem in chiropractic today is nobody teaches you what you want a spine to look like. And when I try to teach it, everyone condemns me and says nobody knows what normal is. Well, I have literature in my files that Leonardo da Vinci drew pictures of the spine back many, many years ago, and he gave 4 curves to it. But you know, all you have to do is look to Gray's Anatomy. Gray's Anatomy will show you what a normal spine should look like. From front to back, it should be straight up and down. And from the side, it has 4 curves. Now, this is what a normal pelvis looks like. Now, you don't have to worry about this right now, but certain criteria has to be there. And if it's there, you don't play with that pelvis. And if it isn't there, then you try to find out why. This is the important when people differentiate between subluxations, fixations, misalignments, and compensation. Here again, I have to disagree with BJ on the definition of subluxation. A subluxation does not have to be misaligned. That's the only part of his definition I don't believe in. You can have a spine that is in perfect structural position and doesn't move. Now see, I believe that movement is the biggest part of chiropractic. Once you start looking at movement the way I'm going to teach you, you'll find out the answer to health is not in as much as structure as it is in movement. You can have a bad structure and have good movement. You can have a perfect structure and not have any movement. So there's different ways of looking at everything. Now, I want you to think of this door. This door is closed and it's in proper position. But I have the combination. So it opens and closes properly. It keeps out the cold. It keeps in the heat. It keeps out the heat and keeps in the cold, depending on what we want. But that door is in perfect structure position, and it also moves perfectly. That's what we want. Okay? That's a perfect moving vertebra that knows its proper position. Now, we have a door that is fine, but it's open and we can't close it. That's a subluxation. Now we have a door that is out of position and nailed out of position. Now we have a door that is in perfect position. We have the key to unlock it, but it's nailed shut. That is a subluxation in perfect position. So in other words, you can have a vertebra that's in perfect position that moves properly. You can have a vertebra that is out of position that moves properly. You can have a vertebra that's out of position and locked out of position. You can have a vertebra that is in perfect position but is locked in perfect position. That is the worst subluxation of all. You know why? Without movement, it is totally can't find it. You look at the x-rays and you say it's everything. It got the perfect curve, it has the perfect up and down, and you'd say that's perfect. See? Then you have the other one that is out of position, but has perfect movement. We're out of position, but we can move if we want to.
Do you consider that a subluxation?
This here is not a subluxation.
It's out of position, but it's still moving?
Misaligned.
Okay.
It's misaligned. It's misaligned. See? Then you have the other one that is in perfect position and everything will work, but there's a guy over here 9 foot tall that weighs 400 pounds and ain't gonna let you out the door. That's a fixation. See? See the difference? You have something that would move perfectly if it was allowed. That's a fixation. So that's basically how you have to think of this.
What would cause the bone not to move if it is in the perfect position?
Ligaments, muscles, long-standing subluxation. Long-standing subluxation could be from another vertebra. It's affecting nerves to that area, all kinds of things. But those are by far your worst subluxations.
Doc,
Yeah.
excuse me, you just said that a fixation would move perfectly if it was allowed to.
Yes.
Okay.
Yeah.
Then how is
I mean, that door will move perfectly if I would allow you to get to it. I am the axis vertebra. The axis vertebra controls everything below it. And if the axis is locked you're not going to be able to move the third, fourth, or fifth cervical. They are fixated. They are compensated to a subluxation above it.
So then, if that's the case, the definition of fixation, how close is the definition to a compensation?
Well, compensation is, a subluxation is usually fixated. But all fixations are not subluxated. They can be compensated. See? So a compensated vertebra is fixated because of a subluxated vertebra. So they intermingle, is what they are. Okay? A subluxation is also fixated. But there's one word that doesn't belong in subluxation. It does not have to be misaligned. See? Now, I'm not trying to change the definitions, but I'm telling you, I'll prove to you the worst subluxations in the world are not misaligned. They are subluxated in a perfect position.
So what do? Knock them out of the perfect position?
No, you just unlock them. And sometimes you have to unlock them by adjusting the one above or the one below or its mate or all kinds of different things. The rules. I live with rules. And these rules are not something for you to write down. These are rules you have to live with. Chiropractic is not a matter of silly millimeters. Chiropractic is a matter of grossness. When you look at a spine, whatever you're looking at should come right out and hit you in the face. It should be very, very visible. It should not be something that you need a microscope to look for. It should not be something that you need a magnifying glass to look for. It should not be something that there is a heated discussion over. Whatever I look at, you should be able to look at and see the same thing. Okay. Go to the gross area of the spine. What is the gross area of the spine? It's either the cervical or the pelvis. 96 to 4. Cervicals overrule the pelvis 96 to 4. Now that doesn't mean in the number of subluxations there is in the world. You could actually have as many pelvic subluxations as you do cervicals. This is what we're talking about. Where did the problem start? The major subluxations are usually cervical. The secondary subluxations are in the pelvis. But it's possible. It's possible for 4% of the people in the world for the subluxation to start in the pelvis. I stand alone. If we come in, somebody come in this room, there's probably 3 people that we can say in here stand alone. Want to guess who the 3 are? Who in this room stands alone? See, that person standing alone. Who? I'm standing alone. I'm the only one standing up, and I'm up here by myself. Who else stands alone here? Kenny. Why does Kenny stand alone?
Because he's above all.
And he's above it, and he's also got a camera. So he's doing something totally different. And who else stands alone in here? Maureen, see. So whenever you look at a spine, you might find 4 spinuses coming together like that. Then you have one sticking out there with a bunch above him sticking together and a bunch below him sticking together. These are all white spinuses. We have some dark space. We have a white spinus, we have a dark space. That vertebra stands alone. Anything that sticks out stands alone. See? The spinous rules. The spinous rules are very, very easy. A normal spinous will show a partial opening between the vertebrae. On flexion, the spinuses flare, and on extension, the spinuses close. The IVF rule is exactly the same. On a normal flat lateral, the IVS, or the spaces between the vertebrae, are small. On flexion, they're big, and on extension, they're closed. So if you can remember those things, and of course the line rules is the things that we're drawing right now. We're drawing the line rules. And we use that ruler there to do our work with. Who in here has that type of ruler? That type of ruler was found by one of my patients when I started doing this work, and it has been, I think, one of the greatest tools in the world to explain the curves and make patients understand what you're doing. Because not only can you show them what's normal, you can show them how far they're out of line. Is there anyone here that needs a lot of explaining on this rule? Everybody understand this? See, we set up a criteria that we figure the cervical spine should be this way. Should have a curve. Then the ruler can measure any curve. That shows you how, when the ruler slides up and down, what you're looking at. What that means is that number would be the radius in centimeters if that curve was drawn into a circle. So when you have a 500 centimeter radius, you have a great big curve. And anything past 500 becomes a straight line, and that makes you a military neck. Then you merely reverse the rule and do the other way. So the lower the plus, the better the neck. The lower the minus, the worse the neck. So, if I had a 400 plus or a 32 minus, which is the worst neck? Absolutely not. A minus is always the worst neck. A minus 17 is a total reversal. A 500 plus or minus would be almost, you wouldn't be able to tell the difference. It'd be close to a military neck. The lower the minus, the worse the neck. So we have a minus 80 and a plus 400, which is the best neck. Plus 400. Anything is plus is always better. Would you like to have minus $17 in the bank or plus 500? That's all there is to it. That's all you have to remember. So you can measure any curve possible. That is the perfect neck, regardless of what anybody tells you. That's the perfect neck. Now we have what we call the educational line. The educational line. Remember now, you have your center of gravity line already on there. If you don't, put it on there. Center of gravity comes from the front of the sella turcica straight down and hits at the 4th and 5th inner space. The perfect neck. You should draw a line from the anterior tubercle and it should hit all the vertebrae on the front. And the line should set at the 5th cervical inner space. That's A. B is the patient's line. When you're measuring a patient's line, you draw a line down the back of the vertebra. And the reason you use the back is because there's no arthritis back there usually. There's no spurring back there. Now, if you're trying to measure a neck down the front, sometimes you'll have spurs out there and you just don't really know where the bodies are. So when you're measuring the patient's line, you should always measure it down the back of the bodies. And the patient's line should be parallel to the educational line. It should be a plus 17. When a neck is whiplashed, it depends what has happened before the whiplash on how it will occur. If there is no other subluxations in that spine other than the atlas subluxation, the neck should always compensate the same way. Fifth cervical will go out of line when it's whipped. And then the neck will go out of line using the mate system. And you've got the mates in your book there. The sixth cervical will move backward, and so will the fourth. The third and seventh will move backwards. First dorsal and axis will move, and then second dorsal and atlas, and finally, what page is that on? The mates are on page 14. And finally, the occiput and third dorsal will go. This is what you call a perfect compensation. Now in your notes, you don't have what I'm going to show you. I'm showing you fourth and sixth movement, 3 and 7, axis and first dorsal, atlas goes inferior, and second dorsal, and of course on your pictures you have third dorsal and occiput. That now we have a totally perfect compensated spine. This is something you see very, very seldom. Usually a person has multiple accidents. Anytime you've had multiple accidents, or you've been to a chiropractor who adjusted anything other than a subluxation, you will have a out of compensation neck. This is the only time you can have a perfect compensation. Now here's the difference. This neck is compensated. They are not fixated. Most of these vertebrae will be moving normally, except this one. So these are compensated, and they're fixated out of position. But yet in motion, they could all be moving perfectly, except the one that's subluxated. So see, it depends how bad the subluxation is. The first thing that happens is you get a subluxation. Other vertebrae compensate to it. Then if the subluxation still stays here, then all them vertebrae that are compensated will become fixated. See? You got the difference? This right here is a compensation. But if they're moving, they're not fixated. All they are, see, a compensation is usually out of position. It doesn't necessarily mean it's fixated out of position. Now when it becomes compensated and fixated, it can be definitely in position. But there are all kinds of different ways that these things go together. The subluxation is the most important. And that's where we use our rules to find them out. Compensations you'll only see on one view usually. But the subluxation you'll find in all views. And right here, these vertebrae are compensated. We don't know if they're fixated until we start looking at them. Now, if they all move perfectly, and that just that one, then they're not fixated. So you can be compensated and fixated. You can be discompensated and not fixated.
You said they become fixated when subluxation is long-standing?
Yeah. Yeah, the longer it stands, the more things is going to come down the road. Pretty soon you won't have no movement at all. The subluxations are the important ones. Okay, now there is a neck that was subluxated. All of these things are compensating. See, now the important thing here is the occiput-atlas-axis relationship. Here's how a perfect neck should look. See that nice dark space? Atlas should what, people? Atlas should stand alone under normal conditions. Now this atlas is no longer standing alone. It's the only vertebra that stands alone under normal conditions. Whenever it's not normal, it's standing with somebody else. But the atlas should stand alone under normal conditions. Right here is not a normal position. Now, is this caused by a subluxation of the atlas? Absolutely not. Even if that atlas is subluxated, it's not causing that. Now, we have put this atlas back in perfect position. Now we'll be able to find its subluxation if it has to, with motion. Over here, once we bring this back, all of these came back to normal position by themselves. Now, a lot of times, when a vertebra is compensated to another subluxation, the subluxation of it might not be visible. It's majors and minors. The fifth cervical is our major problem on this picture. Now, what our problem is over here, you can bet it's not going to be fit. If there's a subluxation over there, it's going to be an atlas. Here we have all kinds of vertebrae out of position caused by one subluxation. They have compensated to that subluxation. Everything has. Now, once we correct that subluxation, we put them back in position. Now it's time to see if they are subluxated. And the only way you can tell that is by motion. Because when you put that spine in motion, then it should appear different. Anytime you motion something, it should move. If it doesn't move, then it's locked in that position. Now, is it locked in that position because of it subluxated itself, or is it compensated to another vertebra? And that's where the rest of the rules come into play for you. This is a whole different way of looking at subluxation, but it's much more logical and much easier to find and a lot easier to correct, and it gives you a reason for living. I mean, the last 10 years have definitely been my best in chiropractic. I would have never wanted to go another 23 years like I was going, because no matter how much money you're making, nothing can suffice or take place of self-satisfaction. Money is only good when you're spending. But when you're laying in bed in the morning getting up to go to work again, do you really want to get up, or do you wish you could go someplace else? But when you're able to correct spines like that, then you know that you've arrived. I mean, how great it is to go to different colleges and find out that the people who are using this system are the ones that can correct spines, and other spines look horrible. Here's one thing about this system: it'll stand up under stress. And any of you don't ever believe me, come with me at the college of your choice and let me x-ray the people, and you'll find that the people with the most care are the people with the worst spines. It's a disgrace. You'd think in chiropractic colleges you should have the healthiest students. If you go to a beauty school, I guarantee, every now and then you have someone that don't care, but you'll find out that all those girls working there have their fingernails polished perfectly and they got their hair done good. Now, like I say, there's extremes everywhere. But if you're working in a beauty place, the first thing you should do is try to make yourself a little bit more nice. You know, I saw the other day in a place where you could win a prize and become glamorous. You know, all you had to do was feel, geez, I thought, geez, I wonder if they could make me look like some of them pictures they had. And my decision was, don't fill out the application. You're not going to win. They're not going to take on something they know damn well they're going to fail on. Okay, it's lunchtime. You can leave everything in this room, right? Absolutely. Now, for you people who don't know her, Laura Chadwick here is the Dean of Continuing Education. She's my boss. And Kenny Guzik back here, my associate and longtime friend, that come down here, they helped me this weekend. So Kenny's from Indiana. He has a very, very successful practice. He is probably one of the most persistent and consistent persons I know. I taught Kenny about straight chiropractic. He got people well so fast, he damn near starved them. That's the bad thing about this system. It are manipulated vertebrae in the whole world. That's where most everyone does rotary breaks and lumbar rolls. You realize there was a woman killed in Georgia with a chiropractic adjustment last year? It was a condyle lift. First condyle lift she got, she felt great. Second one, she got nauseated, started vomiting, and died within 2 days after, 42 years old. Settlement, $696,000. Whenever you put that, you know, that's that move where they put the head on a twist and then wrap around and just pull it, and you feel it clear down into the rectum. Whenever you put a twist on the neck, as long as you're adjusting straight into your articulations, you don't have much problem. When you get a twist on the neck like that, it really does it. At noon, we did a girl from Pennsylvania. There's a preacher's wife came down here to see us. She was getting lumbar rolls both ways, and her lumbars are rotated like that. Instead of being like that, they're rotated like that. I see anybody who would lay her on her right side and twist her back. That's crazy. But that's what they do. And just destroying her, totally destroying her. Okay, now the atlas we already gave you, the measurement for the normal atlas. Now the atlas can go 5 ways. 18 to 24 is normal. 24 to 30 is superior plus, and anything above 30 is plus plus. And I've seen them go as high as 62 degrees superior. Now that's a lot of superiority. Now if they go below 18 down to 0, we would call that an inferior atlas. And if it drops below level of the floor, we're going to call that inferior minus. Now the zygapophyse angle is a very, very important angle to you. This should be between 35 and 55, with the normal being about 45. Textbooks different. Some will say 42, some will say 43, but 45-degree angle is good. Now the way you measure zygapophyse angle is draw the line down the back of the body, and then draw a line on the zygapophyse of the same vertebra. Now, what's important about this angle is, number one, it gives you a line of drive for adjusting that particular vertebra. But more important than that, it tells you, is there a congenital abnormality? Now, the zygapophyses you have to worry about are the steep ones. And steep ones would be the lower number ones, like a 15 or a 16. If you have a person with that type of zygapophyse angle, there is no way that you're ever going to get them back to a perfect curve. That doesn't mean that they won't be subluxated free. All that means is that they do not have the range of motion that a normal person can have, because that zygapophyse angle will keep them from flexion and extending to the full range. So here's a normal cervical curve. There is a inferior atlas, or a reverse cervical curve. Now that's a superior plus. That is a minus axis. So you have all type of atlas problems. Now this person here would definitely be a person that's out of compensation. This is a third cervical that's gone posterior. When a third cervical has gone posterior, you normally will have a inferior atlas. So if you have a superior plus or plus plus atlas with a third cervical problem, your patient's really in trouble because that's a neck that's out of compensation completely. Now the axis is the only vertebra that doesn't go posterior. Axis tips. Either it tips forward or it tips backward. But it doesn't move straight posterior like the rest of the cervical vertebra does. See, it tips. It'll tip this way in a kyphotic neck, and it'll tip backward in a lordotic neck. So when you're adjusting the axis, when we get into adjustment, we'll show you how much different you adjust it. Now there's when an axis tips backward. See, it doesn't move this way. It merely tips. Either tips backward or forward, like this. It doesn't do this. So the adjustment on that will be totally different. Now you're done with your markings. You should have the patient's line, the educational line, the atlas angle, the axis angle or line, the Ziegler-Palmsy measurement, and what's number 6? What are we doing with number 6 there, Lori?
The disc?
Yeah, we're looking at disc-based degeneration so that we can figure out the arthritic rule and see how long these people have been sick. Now, it doesn't matter what type of neck you have. You put every line on every one. Now, does anybody have any questions on how we arrived at any of these lines? You have that down? Now, this is the view I use for patient education right here. I use this view for patient education more than any other view. I'll concentrate on this. I definitely think that the cervical curve controls a person's lifeline. If you have a reverse neck like that, your days are numbered. I'm going to take you out early. You can have a tombstone that reads, died at 20, buried at 35. I wouldn't have a neck like that for all the money in the world. And now you stand there and tell people how serious this is, they just don't want to believe you. See, most chiropractors don't believe it. Like when I was in school and I'd ask somebody, what about necks like this? That's one of those things. Once you get one of them, you can't get rid of it. That's with you forever. See, I have no idea them guys that taught me what they thought they were in chiropractic for. That'd be like taking your shoes to a shoemaker, and shoemaker wants you to throw them in a garbage can. It's one of those things. But a neck like that will totally destroy you. Now, I'll explain to you how I would explain this to a patient, and then if any of you have any questions as a patient, then I'll tell you how I'd answer. Now, let's pretend that this person has sciatica, and they have a perfect pelvis, which happens many, many, many times. Now, You know, under the system today, if you x-ray a neck, but a person doesn't have any neck problems, then the insurance companies won't pay you. They want you to have a symptom for every area that you x-ray. They have no idea how you can correct sciatica from working from the neck. If you have low back pain, that's what they want you to x-ray, that's where that, because that's the way everybody works, including most chiropractors. You go to a chiropractor's office, if he gets a patient in that has lower back pain, he'll just take the lower back x-ray and won't even bother to look into cervicals. Because they don't realize how it is. Now, how do you get by with that? Well, whenever I look at a person and they have no neck problems and they have sciatica, I just grab them on the axis spinous and press. Sure, there isn't it? Well, then I have reason now to x-ray your neck. You have pain in the neck, right?
Yes.
So now I have a reason to x-ray your neck. See, insurance companies make liars out of you. You have to play their crazy, crazy game. That's why I'll be happy if all insurance companies quit paying you in the morning. Now, don't let that panic you. If they quit paying you, people will still come to you because you have a product that nobody else has. And when you have a product that nobody else has, you have a market. I don't care what it is. And it's so much easier. No hassle or nothing like that when you're dealing that way. But I tell this person,